Is 2022 the year where the pandemic becomes endemic? And does Omicron help with that because it spreads so much faster that we'll have natural immunity?
Well, first, thanks for having me, Francine. And I think that 2022 may be the year that the pandemic enters an endemic phase, but it really depends on what happens and the decisions that are made across the world. As we've seen with Omicron, we were surprised. Basically, on the one hand, there's a fairly massive transmittal rate. On the other hand, it's having a lesser effect in terms of seriousness of disease. And so that are encouraging in some ways, but I think that we have to stay very vigilant in order to get to that place during 2022.
So is the immunity that's provided by natural infection very different from some of the vaccines? And actually, again, does that change the way that we describe this pandemic going forward?
Most of the data that I've seen seems to suggest that the vaccines, particularly the mRNA vaccines, provide a stronger level of immunity than the natural infection. As a result, two things happen. One, you have antibodies in your body for a period of time that can work on preventing the infection in the first place. And two, you have T cells and other cells in your body that are prepared to fight the infection. So the effect, the double effect there, really seems to be quite robust. One of them has a time sensitivity of a few months. That's why we're talking about boosters.
So when will you have an Omicron vaccine ready? I know Pfizer said March, and will we need that vaccine?
You know, again, I think people are making guesses at this, and I'd say our job as a developer and manufacturer, and as you know, we were the first to really pioneer this technology over the last decade, is to create possibilities, and then it's really government's jobs and public health officials' jobs to decide how to deploy them. So we will be ready with our testing starting in weeks, but it's not a very, very long process. But now we have to look at the seasonal effects and expectations, and whether we need a booster rather in the spring than the fall is something that we're going to have to work with officials all around the world to sort out.
Yeah, and that's fair enough. So what volumes of this vaccine, if it gets given the green light, can you actually produce in what time frame?
We've said that our capacity and the forward investments we've made provide the company, Moderna, the ability to produce something on the range of 2 billion to up to 3 billion doses, depending on the volume of dose that we use, the dose amounts that we use. And that further depends on which vaccine we're making, because now increasingly the first, second doses we've vaccinated quite a few people in the world, and the booster can be a smaller dose. So I think it's going to be between 2 billion, perhaps going up to 3 if needed. That's around the levels we're looking at.
So how much of all of your volumes for 2022 will go to low middle income countries, and what does that mean for your gross profitability?
You know, this is something that we've talked about throughout last fall, and it's been a debate around the need on the one hand and the abundance of vaccine that's flowing to low-income countries on the other hand. We are, as we've said publicly, very actively working with COVAX with several hundred million doses there. We've made announcements with the African Union. But at the same time, what we find is in certain places, there is an abundance of vaccine that's come into those countries. And so governments are looking at what they need now versus what they may need later. And that will dictate what percentage of our vaccine, our particular vaccine, will go to low-income countries. Somehow that's been turned into a willingness or a preparedness to deal with these countries. I can tell you, yet again, that very, very clearly that the reason we scaled up our production was in order to be able to provide as many doses as were needed. And with 2 to 3 billion from us, and even more from Pfizer and BioNTech, we think there's enough mRNA vaccine to vaccinate the whole world, and has been for a little while. The problem is we need to sort out the logistics of getting these vaccines into people's arms. And I think far too little is being discussed there. And that's where there's a lot of work to do between governments. And so we'll do our part, but we really hope the rest is done.
Well, we certainly tried our part, and I tried, to keep it in the media conversation. Noubar, overall, I mean, there's now, of course, some people saying that, another booster too quickly to the first one would hurt your immune system. Like, how do we have a complete picture of how many vaccines we need with, is it every 3 months? Is it every year? And the longer-term impact on the immune system?
I'd like to say two things about that. First, this is science that's being prosecuted in real time. And so we really need to make sure that our forward guesses as to, or rather let's call them predictions, as to what may or may not happen doesn't supersede the science. And we are making, I mean, the interesting thing is there's hundreds of thousands or millions of individuals whose data in a real world evidence way we can use to rapidly make these determinations. So yes, there is an immunological basis to say how many doses, how frequently, and we need to study that. I don't think anybody knows that answer up front, so we have to be doing the work. But the important other thing we have to look at is that we can't treat every person the same. There are people with immune compromised conditions, there's people with various other comorbidities. So I think being nuanced around who gets additional doses and how frequently is going to be the next wave. And for that, we need better measurements. You know, we're all as a society now talking about getting tests for the COVID virus. Yeah. But I think we also need tests for the COVID vaccine, tests for the antibody levels so that we know what to do.